I am in my mid-40s and entering this strange land known as perimenopause. In this new land, nearly every ache, pain, sleepless night, brain fog moment, anxiety spike, and extra pound can possibly be attributed to my fluctuating hormones. Nobody really knows. Most of my friends are in this strange land too. Many of them are here tonight. And let me tell you something, we have questions. Like, why didn't anyone tell us this was gonna happen? And is it really gonna go on for 10 years? And should I actually be going for walks while wearing a weighted vest? And how come I have to navigate this rite of passage while I have young kids and aging parents who could really use my help right now? Dr. Pooja Lakshmin, who is a psychiatrist and author who you'll meet in a minute, she described this phase of life to me as a panini. It's like a sandwich, but hotter and more squished. Honestly, I think that's perfect because I do sort of feel like a panini. Like George Foreman, just. I want to share a quick story about what this night means to me. So I have 3 little girls, twins who are 11 and a 7-year-old. And I took my youngest daughter to swimming lessons yesterday. And after Margaret's lesson, I was in the locker room waiting for her to shower off. And there was an older woman getting dressed. She was standing around in her underwear, as one does. She was applying moisturizer to her heels, you know, normal locker room stuff. And the scene reminded me of when I was pregnant with twins, when swimming was just about the only exercise I could pull off. I'd go to the pool week after week, getting bigger and bigger, and the women who also swam started to become familiar to me. They'd check in on me, make sure I could heft myself out of the pool. They did not flinch once I reached the size of a beluga whale. And by the end, we were all counting down the weeks till my due date together. Those women understood what it meant to be that pregnant, to feel that full, metaphorically and physically. I did not know their names, but I felt a real kinship and community in that locker room. And I'd love to feel the same sort of kinship and support with women during this next big phase in my evolution. And some brave men too, you know? So maybe folks in this room also feel that way. Any hands? Anybody? We got a wild crowd over there. Watch out for those people. So my mom joked to me that menopause is the, and I quote, cost of being a baby-making being. So here we are. Morra Aarons-Mele, who's a feminist, an author, and a mental health advocate, is going to be our moderator tonight. Dr. Sherrie-Ann Burnett Bowie will help us understand the science, the biology of what's happening to women's bodies. Dr. Pooja Lakshmin is our mental health expert this evening. And Shannon Watts will help us learn how to advocate for and demand the care women need and deserve. But before we get to that panel, we're going to start by laughing a little bit because I am a big believer that if you can laugh, you can keep going. So please welcome to the stage humor writer and author Lisa Borders. She is going to read a piece she wrote for McSweeney's that went viral and still is all over the internet, first published about 10 years ago. Lisa, come on up.
Thank you. So the only thing I want to say to introduce this piece is that because it is about 10 years old, while a few of the pop culture references may be just a little bit dated, unfortunately, some of my perimenopausal symptoms appear sadly to be eternal. Signs that you are a Gen Xer going through menopause. 1, you sweat those newly applied purple streaks right out of your hair. 2, you use the word fuck more now, even more than you used it in the 1980s. And you swore a lot in the 80s. 3, previously, you thought you were too punk for Sufjan Stevens. Now you hear a song of his in the car and sob uncontrollably, thinking, Sufjan, you may be young enough to have been a Comp 101 student of mine back when I was adjuncting in the 90s, but you're still the only one who understands me. 4, you start referring to anyone 15 years or more younger than you as the kids. For example, what is all that fucking horrific monotonous bass coming from the apartment above me? Oh, must be the kids and their fucking EDM again. 5, sometimes at the very beginning of a hot flash, when your face is prickly and the sweat is just starting and the lights in your living room seem to suddenly strobe, you convince yourself that it's 1987 and you're back at Man Ray dancing to the Sisters of Mercy, and it's not the end of the world as you know it, and you feel fine, really. 6, you have, on more than one occasion, Googled an acronym you've seen the kids post online, and the realization that this is something your elderly mother might do cues a sweat tsunami. 7, spoken aloud while looking in the bathroom mirror. What the ever-loving fuck is going on with my neck? 8, you hear that new St. Vincent song on the car radio and sob uncontrollably, thinking, Annie Clark, you may be nearly young enough to be the child I might have had if I'd been pregnant that time I missed my period in 1985. But you're still the only one who understands me. 9, you're 50 and still underemployed because Gen fucking X. 10, you privately think the kids are alarmingly intolerant of free speech these days, but you'd never say this aloud or online because the kids are your bosses. 11, what the fuck is up with Cage the Elephant? Do they pay royalties to the Pixies on every fucking song? Why don't the kids just listen to the fucking Pixies instead? Fucking hell, I'm getting a hot flash. 12, injustices besides Cage the Elephant's career that can trigger hot flashes or rage sobbing include mealy peaches, being cut off in traffic by a gas-guzzling pickup truck festooned with unironic "Don't Tread on Me" flags and Trump bumper stickers, having a project you designed and developed canceled on a whim by a manager who's young enough to have been the baby you, thank God, didn't conceive that time you forgot your diaphragm in 1986. 13, suddenly you can't hold your liquor. This is especially bad because your plan for dealing with old age had been to get rip-roaring drunk every day from age 70 on. 14, the San Junipero episode of Black Mirror makes you sob uncontrollably, thinking, Charlie Brooker, you're the only one who understands me. 15, you realize that all those times you thought you were enjoying things ironically, you were really just enjoying them. See Lifetime movies, Bonnie Tyler's A Total Eclipse of the Heart. 16, you never thought you'd ever get this fucking old. 17, whatever.
Thank you, Lisa. I'm sorry it all holds up. I want to now welcome our panelists to the stage. Please welcome Dr. Sherrie-Ann Burnett Bowie, Dr. Pooja Lakshmin, Shannon Watts, and our moderator this evening, Morra Aarons-Mele. Thank you.
fun. Okay. Hi.
Hello.
Hi. I'm Morra. I'm your moderator. I'm 48. I'm fired up. We really want to hear from you tonight. And so please send your questions to slido.com. We will be mixing in questions with questions for our esteemed panel that I pose, so bring them on. We thought that it would be really helpful to approach this conversation about perimenopause and menopause from a biopsychosocial perspective. I don't know if any of you went to social work school, but menopause is a full body experience, it's a mental health experience, and it's a social experience, both at home and in the world. So our panel will deliver just that for you tonight. Dr. Sherrie-Ann, I want to start with you to really orient us. You are a principal investigator of the SWAN study, which is almost 30 years old. It is the largest, longest study of people in menopause. And I'd love you to share just a couple of great nuggets that you've learned working with SWAN all these years.
So it's wonderful to be here. And I think the first thing that I hate to have to share is that up to 80% of women will experience hot flashes. And they can happen as early as in your 30s and as late as in your 70s. And there's no necessary rhyme or reason. So just because you haven't had them doesn't mean that you won't get them. 3/4 of us will have memory component to our hot flashes. And the last thing I'll say about SWAN, I'm loving the fact that we're talking about menopause so much because the study was called the Study of Women's Health Across the Nation in the 1990s because it was controversial to say menopause.
Wow. That's bananas. I'd love you to orient us into the bio piece of menopause. I'm going to assume, this is a very smart audience, that most of us know does my husband know the mechanics of what's happening? We'll deal with that later. I'd love you to orient us a little bit in the bio piece of menopause. I'd love you to give us an overview and sort of drill down as a prescribing physician into the symptoms that you see most often in your clinic.
So menopause is when you have not had your period for 1 year. If you're 8 months in and then your period comes back, then you restart the clock. But it's 1 year of no period, and then the menopause transition is the 1 year before that final menstrual period, and then the 2 years after, where there's most of the major activity. It's a reflection of not having as much hormone, specifically estrogen. The most common side effect by far are hot flashes, and I am not ashamed to say so I'm 53, and while I was a premenstrual woman and a researcher, I kind of dismissed hot flashes. I said, it can't really be that bad. Boy, was I wrong. And if you wonder if you had a hot flash, then you haven't had a hot flash. So
Do we want to cue the clip? Is now a good time to cue the clip? Should we cue the clip?
Okay. So that is a hot flash. And behind the scenes, your body believes that you're actually hot when you're not. You then begin to vasodilate, open up your blood vessels, you begin to perspire, and your skin gets really hot. And I love it when my family is like, can we cuddle you because you're so hot? No. But that is ultimately, it's the loss of estrogen that leads to it. The most common symptoms are hot flashes because, in all seriousness, the impact that they have on functioning, imagine being in the middle of an important meeting and having that happen, the impact on memory that happens with the menopause transition, the impact on sleep. So I think the cognitive, and we'll hear more from our amazing co-panelists about this, but those impacts of hot flashes and memory fog, weight gain, belly fat, because you actually lose muscle and gain fat. And it can be deceptive because your scale might not change as much as the body composition change. And then, of course, all the stuff with your heart and your bones.
Talk a little bit just quickly about bones. I know that's something that you treat a lot.
So I am a card-carrying bonehead. I actually came from clinic, osteoporosis clinic. So all women, so SWAN was very unique because in the 1990s, it was a community-based sample. At each of the 7 sites, half of the women were white and half of the women were Black, Chinese, Japanese, and Latina, so we could really understand the similarities and differences. And what we know from all of our longitudinal studies is that there's a significant amount of bone loss that happens. Within up to 10% of bone density is lost, and in the first 10 years of menopause, and that really increases your risk for fracture. And the problem with fracture is that when a woman or a man has a hip fracture, 25% of them will die in the year after hip fracture, and 33% of them will no longer be able to live independently because of impacts on mobility.
So you got to invest in those bones now. Cool. Thank you. Dr. Pooja, you are a psychiatrist. You are also expecting babies. We should just say congratulations.
Thank you.
Twins.
Twins, yes.
You specialize in treating women and our hormones. So mental health and women is a rich and complex topic I could personally talk about for days. But I'd love to know what you think is really important for women to know as they enter the perimenopause and the menopause journey. Like, what looks different about this time psychologically for a lot of us?
Yeah. Well, first of all, it's just such a pleasure to be here and to be with these amazing co-panelists. So I'm really excited to have this conversation. When I first went into perinatal psychiatry, which is sort of the technical term for women's mental health in the psychiatric field, I was very focused on maternal mental health. And that was maybe like 7 or 8 years ago, where I feel like postpartum depression was like getting a lot of airtime, and we were talking a lot more about things like postpartum rage and things like that. And it's interesting because as my patients have gotten older, and as I've gotten older as well, I think we are kind of in a new era where we are coming to understand that the changes that happen during menopause are just as huge and transformational as the changes that happen during pregnancy and postpartum. And the changes that happen in menopause happen to you whether or not you decide to become a mother, which is an important distinction between the two. One of the ways that I think about this with my patients, and so one of the things that I see is like I'll be talking to a patient and they'll be like, yeah, like, I have this brain fog. I feel like I can't remember things. Like everything just feels like a mess. Like I feel like a mess all the time. Everything feels like a mess. I don't know if it's my hormones. I don't know if it's the fact that I didn't sleep last night because I had a kid that was up. I don't know if it's the fact that I have ADHD. I don't know if it's because I'm pulled in 20 different directions because I have a parent who suffers from Alzheimer's and I'm their primary caretaker. And I usually have a pretty frustrating answer, which is yes, all of those things, because it's so intertwined. It's so interdisciplinary. And I see the hormone, like the bio piece of it, as like that's the first layer. Like we need to advocate for ourselves, which Shannon will talk about, and really figure out how to get the biologic piece under control. So then we can do actually the really important work of this like midlife transition, which I think one of the reasons it's different is because we don't have a vocabulary to talk about it. Like when you're in your 20s and your 30s and maybe in your 40s, like you have all these milestones, like you have like, going to college, graduating, maybe getting married, maybe having a baby. Like there's things to look forward to. There's like markers of time and there's specific goals and purpose. But when we think about like midlife and later life and end of life, I think like as Americans, we haven't done a great job of really giving ourselves a structure and a way to kind of like demarcate what's happening next. So many of my patients are kind of like, they're still drowning in caretaking, and they still, have kids at home, and now their parents are requiring help. They're trying to work their job, and they're kind of feeling like my role has shifted. Like I don't really know who I am as much anymore. I don't know, like before maybe my kids needed me more, and that was such a primary force for my identity. And now things have changed and I don't really know what comes next. So I often talk with my patients about the Erikson stages of development and how in midlife, actually the transition that we're going through, like the conflict that we're going through internally is stagnation versus generativity. And I don't want to take too much time right now. We can talk about this more, but really if we're talking about generativity in midlife, that means like you're still changing, you're still growing. Like we haven't come to the end yet. Like there's still so much more. And so what I would love is for us to learn how to advocate for ourselves so that we can make sure that we feel complete from a physical standpoint, so then we can do this deeper work for ourselves to figure out like what is our next season, what is our next stage, and really kind of be empowered going into that.
Yeah. Shannon, you are generative in the most beautiful way. You actually just launched something called Firestarter University, which everyone can sign up for. You have written a lot about your own journey through menopause personally, everything that you've learned. I'd love you to share a little bit about that. One of the things that you wrote that was a little frustrating, and I don't know if any of you can relate to this, is that if you expect your general practitioner or even your OBGYN to diagnose and treat your menopause well, you may be in for a frustrating conversation. I hear a lot of yups. Was that your experience?
Yeah, so just to provide some context. So when I was 41 years old, I started an organization called Moms Demand Action, which some of you may be familiar with. And so I was able to organize this army of angry women across the country to take on the gun lobby. And here I was very angry when I was about 49 years old, not about gun violence, but about the fact that I was going through menopause and I felt like I had no support whatsoever. There was one afternoon I was sitting in the living room. My husband said, "What are you thinking about?" And I said, "Using a chainsaw to cut the couch in half." And he thought that was a strange answer. And to be fair, it was a strange answer. But I just had all of this anger. And it was, my hormones were changing. And so I thought, I'm going to go to my doctor, my GP, and see what she says. It was a woman. And she looked at my panel of blood tests. And she said, "Looks like you're in menopause. Are you okay with that?" And I was like, what are my options? I don't know yet. And so I just went on this journey. And what I realized is like so much of what our generation, I'm a Gen Xer, I'm 54 now, what we know about menopause is what we have learned by accident or through someone who told us, right? This whisper campaign that women rely on to keep us safe for so many reasons, but we shouldn't. We should have data and information. I ended up reading a lot. I read a book called Estrogen Matters that I thought was really profound. It's sort of my Bible. I proselytize out of that a lot. Like, let me read you a chapter of Estrogen Matters. But I went to a doctor who said to me, the fact that you have no libido, the fact that you're having hot flashes, the fact that you are feeling like you want to cut your couch in half with a chainsaw, like all of these things are symptoms of menopause, and we can try to treat those. And I understand that HRT isn't for everyone. I will say it was everything for me, but it is not suitable for everyone. But we should have the option of understanding that it is an option. And I feel still very angry about the fact that our generation, our mothers, did not have those options, and many of them suffered because of it. And so I am on a journey now to help make sure that that army of angry women who advocate for so many things, including gun safety, are also advocating for us to have access to information and treatment.
Yes. How many of you have experienced sudden bouts of rage? Yeah. Audience, do send us your questions. It's Slido, SLIDO.com. And I think the keywords, again, are COG. Cloe, what are our keywords? Duh. I'm going to chalk that up to brain fog, because why not? I'm going to throw out a quick audience question, and I think I'm going to look at you, Sherrie-Ann. Does weight training help slow down bone loss? And can you rebuild bone through diet and activity?
So yes, yes, and yes. The Lift More study, LIFT-MOR, showed that when you are working out like 80 kilos, deadlifts, squats, can not only maintain bone density, but improve bone density, ideally with a trainer, so that you don't injure yourself. So yes, serious weight training makes a big difference.
Okay. How often?
In the study, they were doing it 3 times a week, 2 to 3 times a week, which of course has a financial implication.
Yeah. How long does it take to get from wimp to those 80 kilos? Speak for yourself.
I would argue it's mindset and being gracious with your body, because our bodies are amazing.
Well, actually, so that brings me to a question for you, Pooja. You wrote an amazing book called Real Self-Care. Everyone buy this book. So good. What does real self-care, not bullshit Instagram goop self-care, what does it look like for us?
Yeah, the subtitle of the book is Crystals, Cleanses, and Bubble Baths Not Included. So it's a little bit of kind of a side eye to the wellness industry, which has come for menopausal women, particularly. Like which, I think I have mixed feelings about that, because on one hand, it's great that we have women entrepreneurs that are building and that are getting funding, and we have men that are trying to go to Mars, and women are just trying to feel better here on Earth. But I think we have to be careful about some of the stuff that can get really predatory. So my take is that real self-care is actually an internal process. It starts with navigating your own relationship with yourself. So it starts actually with boundaries and learning what your limits are, and understanding that we're all living in an ecosystem that runs on the guilt of women. And no matter kind of what industry you're in, no matter how you came up, you are working and living in a system where your emotional labor is being taken for granted. And so your first step to real self-care is understanding that when somebody asks you to do something, you have a choice. You can pause and you can say yes, no, or negotiate. Because no always comes with a cost. Like a boundary always comes with a cost, whether it's financial or interpersonal or emotional. But when you pause, you can at least start to imagine that no is possible, that no actually could be in the realm of possibility. And the other side to this is, again, like just talking about what I see in my practice, where my patients are in this panini generation, where they're taking care of their kids, they're taking care of their own parents, they're working full time. We need to learn to ask for help too. Like we need to be able to lean on our communities, especially in these times. So I like to tell a story that, I was with a patient, it was a therapy session, we were chatting about something, and she kind of offhand mentioned like, my partner's he's gonna be traveling for work this week. He's gonna be gone for one night. My sister offered to come over and help with like bedtime and bath for the kids, but it's fine. It's just one night. I don't need it. And I was like, yeah, but she offered, like, why not accept the help? And my patient, like, she was just like, yeah, I guess I just didn't really think about it. Didn't think of it that way. Like, my automatic response is to be like, no, I'm fine. And I thought that that was just such a perfect example of, like, we need to learn to receive help. Like, that's actually a skill. And the best way to start doing that is actually before you need it, so that you actually can practice the muscle, as opposed to waiting until you're, you know, like on the bathroom floor on your knees. You want to actually start to build that muscle. So I would say, like, the boundaries piece and really looking at what your limits are, like, to do things like be able to prioritize your own exercise and movement. That means, like, having to be really honest with yourself and say, like, okay, this is my priority right now. I'm not going to be able to, you know, volunteer for that committee or, you know, bake cupcakes for school or whatever, you know? So it's like, I think we have to be sort of ruthless in our prioritization of what is really important to us. And then we're modeling that for the next generation too.
Yeah. This is a great audience question, and whomever wants to take it. What do you see as an ideal healthcare model to prepare, support, and treat women as needed through menopause? That's a very good question.
I think really even starting with asking how things are going and what is your experience of specific symptoms related to menopause for women who are 40 and up. That would be the starting point for me.
The doctor would be asking.
Or the healthcare provider.
Yeah.
I think one thing that I would say is, you know, healthcare is so siloed. And as Sherrie-Ann mentioned, there's so many different organ systems that are impacted by menopause and perimenopause that, like, you can have a full-time job of going to specialists, which is probably what ended up happening for you, right, Shannon? Like, where you're, like, trying to find the right providers. So I think it would be so amazing to make this in the way that we sometimes see in community maternal mental health programs, where it's interdisciplinary and you can go to one place and see a bunch of people at the same time. It would be so amazing to have that be something that's more standardized for this phase of life.
Shannon, I have to ask, speaking of a holistic model and specialists, 2 parts of your regime that I know our audience will be interested in is you take testosterone, you've written, and you do something called a Mona Lisa.
Yes.
Do you want to tell us about that?
I mean, I have no choice at this point, but
Sorry, wait.
so I do, you know, every day I wake up and I put estrogen on my leg. I actually go through this on Instagram, so I showed other women because this was how unfamiliar my audience was, and I have millions of followers. So I thought, okay, I'm just going to share how I do this. So every morning I wake up, I put the gel on my leg, I put the testosterone behind my knee, and then at night I take progesterone. And you know, the doctor can explain why that is important, but I can tell you it does help with my sleep for sure. And what I noticed after I started this regimen was that I had my brain fog cleared up for the most part. I had better memory. I definitely had libido. I felt like myself again. And, you know, Pooja and I have talked about this a lot because we're friends, and we've talked about sort of how self-care and advocacy go hand in hand. You know, something I did after my experience that I think we can all do is to go, I don't know if you have One Medical here, but in California, there are these different providers, and they're called One Medical. And I asked them, why don't you prescribe HRT? And they said, we just don't have any experts. We don't have the expertise, which is another issue in this country, right? Because in the 90s, there was sort of a freeze on doctors who were studying this. And so what you find is that there are very few experts in this field, or not enough experts in this field. So I went to One Medical and I said, I pay for this service. I expect you to have experts who will prescribe HRT. I don't want to have to go to 5 different experts every time I want testosterone or I want a different thing. And we can get into this whole conversation, but by the way, every single estrogen product still has a black box on it. There's still no women's dose of testosterone. I have to take it off label and pay for it in full. And One Medical, which is a huge chain of offices, reached out to me and said, we're going to start having doctors here who will prescribe HRT. Like, that's all it took, was for me to bring it up and to be angry and to ask for it. And so I think that we have to get comfortable. You know, sometimes middle-aged women are invisible in society, but we have to get comfortable and say, you know what, we have $15 trillion worth of spending power. Maybe we should exercise it.
Yes. How many of you take HRT? 15%, 20%? Yeah. Well, we can talk. Send us your questions. You didn't talk about the Mona Lisa.
Sorry, the Mona Lisa.
You don't have
okay.
to.
No, I don't mind. The Mona Lisa, and I'm not a doctor, so I'm just telling you my experience. But I was using vaginal estrogen, and my doctor said to me, why don't you try the Mona Lisa laser? So this is a laser. It's like an ultrasound. They stick the ultrasound into your vagina. It changes the tissue. It emits some kind of, I don't know what it is, if it's like an ultrasound, but the point is to help keep your vaginal tissue younger or fresher or, you know, more moist, so that when you have sex, it isn't painful, which is a huge symptom during menopause, and it was for me. So it has been very helpful, and I go in every 6 months and do this laser, which also is not paid for by insurance, but I pay for it because it helps with my quality of life.
Yeah. One of the things I thought was interesting from the SWAN study is that it's a commonly held myth that women need to keep having intercourse to prevent the symptom of pain during sex. Can you talk a little bit about that?
A man wrote that.
So whether you have sex frequently, so SWAN actually showed, because we've collected a ton of data on the amazing 3,302 women who have been a part of the study since the 1990s, that if you were someone who had sex frequently versus not, that didn't necessarily change your likelihood of having pain with sex. Definitely, there's a higher rate of vaginal dryness with going through menopause, and the importance of both vaginal estrogen and lubricants to mitigate. I will say that I'm not familiar with the Mona Lisa ultrasound, and I would be remiss if I didn't say, and you acknowledged it, Shannon, that the use of testosterone in women is off-label, and there are some concerns about how the safety of it. So being clear in terms of what is regulated, what needs to be studied still is important.
Yeah. Let's talk about brain fog. We have a question from the audience. What is the physiology underlying brain fog? How do we treat it? And is it permanent? We should probably define brain fog too.
So it is forgetfulness. It is difficulty learning new concepts, and in that menopause transition, there is like 1 year before and 2 years after. You can definitely have, because our women have done certain exercises over and over, difficulty in learning new items. Why brain fog exists really is not known definitively, to my understanding, other than there are estrogen receptors in the brain, and with menopause you have less estrogen. But this piece of, and I think one of the classic examples is going into a room for something and then wondering, well, why did I go in here again? That would be, to me, a classic example of brain fog.
Is it permanent? Oh, Pooja, go.
Well, I was just going to jump in too and say it can be tough to tease these things out, because I sometimes am making diagnoses for my patients of like later in life ADHD diagnosis, and there can be brain fog with ADHD, or even long COVID can have brain fog. So I just had a patient recently where we're finally getting clear on what is this diagnosis, and it looks like it's actually more long COVID, but she also is in perimenopause too. So we're kind of oftentimes dealing with so many confounding variables. But I think like the moral of the story, I think is finding providers, finding clinicians, finding doctors who you trust and that are willing to sit down and spend time with you and have a conversation, because there's not like a one size fits all with these treatments. Like we use SSRIs sometimes for hot flashes, but also sometimes people can have hot flashes as a side effect of SSRIs. So you really want to be able to find experts, professionals who are willing to be partners with you and like really figure out like, okay, what's the most important thing for my quality of life, for my functioning? What do I want to prioritize? Which side effects am I okay with? Which side effects are intolerable? And then also be open to knowing that because menopause is actually, it's a transition, that there probably will have to be changes that are made. So it's not like you're just on one thing and you're on it forever, which is also why it's important to have a healthcare team that you feel like really can be a partner with you, because you're kind of constantly going to be keeping tabs and seeing how things are going. And maybe we shift that, or maybe we try this, or maybe we add that.
Yeah. I want to get into HRT, but I want to ask Shannon a question, just pinging off what you just said. You know, what you're really talking about is the power of self-advocacy. I'm a pretty outspoken person, and I have a heck of a time advocating at the doctor's office and being taken seriously when they have 15 minutes to see me. Shannon, I'm curious, as an advocate with a capital A, if you have advice on how we take ourselves seriously enough.
Yeah, look, I think that is something that you hear a lot from women, right? That we are expected to be good. And if we are not good, then we feel like we're not fulfilling the role that we are supposed to play in society. You know, how many of us have gotten an IUD and thought it was the most insanely painful experience of our life, and yet we were given absolutely no pain treatment whatsoever, right? And it's only because women have started talking about this that is changing in our society. And things don't change unless we all use our voices and our votes. And, you know, women are the majority of the voting public, and yet we only hold about 25% of the 500,000 elected positions in this country. We're only about 5% of the Fortune 1000 CEOs. So really, we only have certain levers of power, and one of those is using our voice and just pointing something out when it doesn't feel right or it doesn't seem right. And bringing it up. And again, I'll just use an example. You know, I tweeted the fact that I have a kid who has an eating disorder. And so every time we go to the doctor, no matter what, they want to weigh them. They want to weigh my kid. And they want to tell my kid their weight. And I went into the doctor and they decided they were going to weigh me and tell me my weight. And I got so mad and I said, do not weigh me and do not tell me my weight. And they had no idea why, right? But I just had this history. And I tweeted about this, and 5 different doctors' offices wrote to me and said they were going to change their practice of how they weigh their patients and how they tell their patients their weight. They're going to give them a choice. They're going to say, do you want to be weighed? And if so, do you want to know what your weight is? It's only by having those conversations. And I'm not saying go in there, you know, angry and confrontational. I'm just saying, say the thing you're thinking. Because the thing you're thinking, someone else is thinking too, and you might help someone else by saying it.
Can I add one thing too?
Please.
And I think it's so important to, like when we hear Shannon talk about these things, I think sometimes it can be easy to be sort of like, yeah, but you're Shannon Watts. But the reality is that, like we all have that power, and power. There's a lot of power in numbers too. And so I find like with my patients, if you can find yourself like an ally, if you can find yourself someone who's kind of like in your corner, who's going through something similar, and have them be able to give you some of their energy and anger and be sort of indignant on your behalf, that also can help for us to sort of be able to speak up and say, hey, wait, yeah, like this isn't right. And it's important for me to say something.
I'm just going to see Shannon in my corner.
Next time I go with all of you to your doctor's appointments.
Okay, let's talk about HRT. Many people are asking, is hormone therapy safe? Why is it so controversial? Why do we ask these questions about it? One audience member says, my doctor recommended HRT, but I've read concerning increased risks with this. How do we begin to weigh this option? Do we want to define HRT first? And then, yeah.
So if you have a uterus, HRT should always be estrogen and progesterone. If you don't have a uterus, then it can only be estrogen. The controversy came because I would say in the 80s, based on the Nurses' Health Study, there was the belief that, which is an observational study of nurses, that HRT was everything that women should be on. And then the Women's Health Initiative, which was actually a randomized study where some women received HRT and some women received placebo showed that there was this higher risk of specifically blood clot related diseases, stroke, heart attack, and a higher risk of breast cancer and uterine cancer in women who were on hormone replacement therapy. And that was when there was a big dialing back of who would the recommendations for treating.
And when was this?
That the Women's Health Initiative came out, I want to say, in the late, early 2000s, roughly.
Yeah.
The Menopause Society is a phenomenal website to access to find out who are providers of HRT, because essentially this in the last 10 years in particular, there's an appreciation that if you are recently perimenopausal, that HRT is quite safe. If you have had taking it either transdermally through your skin or orally, if you are 10 years out, that's when the risk for those complications increases. And if you have a family history or predisposition for blood clot or cancers that I mentioned, then it most probably is a question mark at any time. Vaginal estrogen, of course, speak to your providers, but vaginal estrogen, which makes a big difference in urinary tract infections and vaginal pain and sexual pleasure, that has none of the complications related to taking estrogen through your mouth or through your skin.
Pooja, I know you don't prescribe HRT, but you prescribe other valuable medications. What are the conversations you're having with your patients, who I would assume come to you for ostensibly psych issues, about the role of hormones and hormone therapy?
Yeah, so it's kind of, I mean, it's similar to what we've been talking about here, which is that you want to, like, we need to tease out the symptoms and really get a sense of which symptoms of perimenopause or menopause are causing the most concern and are really impacting your quality of life. Usually, pretty much for everybody, I will refer them out to an OBGYN. My practice is in the DC area, so somebody who focuses who is an HRT provider in that area. But then outside of that, from my standpoint, we're looking at things like cognition, and we're looking at anxiety and mood, which are both, kind of comorbid during this time period. So I prescribe a lot of SSRIs, but I also am somebody who's pretty conservative with medication. So I like to have these conversations be sort of like an ongoing thing where we're looking at the dose and we're, seeing if we can come down. Like, nothing is static. And then, like I mentioned earlier, I do therapy with a lot of my patients. So we're spending a lot of time talking about the fact that this is an identity shift. This is about, like, finding what is your purpose in life? Like, how are things changing? Like, with my patients, I'm seeing, like, usually at this stage of life, your kids are getting a little bit older. They're a little bit more independent. You're dealing with role reversal with your own parents. You're more in the parenting role for your own aging parents, which can be tough from a mental health standpoint for adult children. And then you're also usually dealing with questions around career. And sort of like, where am I right now in my career? Do I want to keep doing the same thing? Is it possible to keep doing the same thing? I often say to my patients, like, we all have probably like 5 or 6 careers in us. I'm on my 3rd right now. I probably have like 2 or 3 more, and so I'm often like helping my patients kind of figure out what is this next stage. And so much of it is about, like, being willing to take a risk on yourself and being willing to advocate for yourself. Of like, hey, I'm going to go back to school, or like, yeah, I think I'm going to run for city council, or like, like, it's different for everybody, but it's being willing to kind of say, you know what, it's worth it. I'm worth it. And it's worth it for me to, like, put this extra energy and financial investment in for myself.
I do have to say that to me, the most exciting thing about being this age is that I feel like me and my friends, we are fired up. we are not to be stopped anymore. Like, the fucks are not there to give. The mental health is tenuous. But the energy is there.
I have a lot of job security.
You will never be out of a job. Another question from the audience. What biomarkers are there of menopause? Why did the doctor say, looks like you are in menopause based on a panel test?
So the best test is FSH, follicle stimulating hormone, which is a hormone that comes down from our pituitary gland that's at the base of the brain, sort of behind here, and stimulates our ovaries to make estrogen or estradiol. And as estradiol levels decrease from the ovary, the FSH levels go up. Swan also identified AMH, anti-Mullerian hormone, or MIS, which I can't remember what that stands for right now. No, it's Mullerian inhibiting substance. As that goes down, that also predicts menopause.
Got it. So audience, we have about 9 minutes left. So if you've been waiting on a question, do get that question in. I have so many good questions here. I have a fun one. What is your favorite menopause or perimenopause memory or instance? And Pooja, this may not apply to you, but you can.
I'll be there soon.
I mean, almost deciding to cut the couch in half with a chainsaw was a good
That's a
one.
pretty good
But, you know, there are a lot of times that I just lay on the floor of my closet and, you know, children will come up to talk to me and my husband will come up to talk to me and I'm either in brain fog or having a hot flash or some kind of meltdown and people know where I will be in my family, which is laying on the closet floor. It's like my office. I have office hours.
Very good.
So in the midst of a hot flash, sticking my face in the freezer. Did it help? For a little.
We want to hear yours.
Oh, I think that mine is, I kick the dog sometimes. Not in a mean way, not in like a hard way, but the dog really knows how to get under my skin in the middle of the day. And he looks at me and I just get filled with rage. But I would never hurt an animal. But it's come close a couple times. Because the emotion, it's interesting. The emotions come on. I don't know if you all experience this. You can have like 40 emotions in an hour. I don't know if you ever get confused, sweetie. It's like she's happy, now she's crying. What's going on? So the emotions are very volatile, very labile, right? And there's so many of them.
Yeah, well, and it's one of the things that I always think about for women is like we go through so much change hormonally during the course of our lives, and it's just wild that our nervous systems are so resilient that we can handle these huge fluctuations. I mean, what we're describing is so similar to like how it could feel in that immediate postpartum period.
Yes. Or when you have PMS.
Or when you have PMS too.
Yeah.
And it's a different type of feeling because, right, you really don't feel like you're in control and the volume is so high. And so that's part of what makes it so difficult because the volume is so high and it comes out of nowhere and there's usually not a trigger. So then everybody else around you thinks that you're just loony. But hopefully these types of conversations will help with educating folks.
Yeah. As we round out, here's another audience question. Federal scientific funding bodies are weeding out study proposals with gendered terms like, quote, women and, quote, endometriosis. Is research in menopause in danger?
Yes. All research is in danger, quite frankly. And I would encourage you, I work and live in Massachusetts. So our Congress and our representatives are aligned with the values that I just espoused. For your friends and family members across the country where that might not be the case, as much as you can, please encourage them to call their representatives, because health and science should not be political, and it is scary right now what's happening.
I need to throw in one question about work because I'm a workplace person. And all these symptoms, we bring them to work. We bring them to our kids and the dog, but we bring them to work. Have any of you had conversations or coached people on having conversations about talking to colleagues about what you're going through or what you might need differently?
You know, I think that it is important to have those conversations, just like we said, talk to your representatives, talk to your doctors, talk to people in your workplace. I don't think it will shock anyone in this room to know that other nations like Europe, make huge ways for women who are going through menopause to have accommodations. And we don't do that here in the United States. And so we should be having these conversations because, as Pooja was saying, if we have these conversations in numbers, for example, in the workplace, then we can advocate for more menopause-friendly workplaces. And, you know, I would say there are two things here. We all have to be an advocate for our own health care. President Biden had promised $12 billion for women's health care research. He had promised hundreds of millions of dollars for menopause research. That will probably not come to fruition now. And that means that we're going to go backwards. In all these conversations we're having, we're going to go backwards. We don't have to go backwards. We are the majority of the voting public, and we should be demanding in our workplaces, at our doctor's offices, with our lawmakers, Republicans and Democrats alike, to prioritize this funding for our well-being. Because, you know, at 54, I'm in the prime of my life. I am smarter than I've ever been. I'm wiser. I'm more compassionate. I am ready to do a million different things between now and the end of my life. But that will depend on my ability to be healthy. And that only happens if the people who allocate money and make sure that we can be in workplaces and thrive, that all matters if they hear us. And so if I can leave anything with you tonight, it is every single one of you in this room, your voice matters as much as any of our voices. And so when you voice yourself, what is not working for you or what you want, when you do it together in numbers, I mean, I am proof positive. I was just some random lady who lived in Indiana who started Moms Demand Action, right? And we've passed 500 good gun laws since then. Not me, a group of women. So I would just say to you, you are all advocates, you are all leaders, you can all make this happen.
Okay, I have two more questions. We have 1 minute and 15 seconds. First, a medical one, and then we're going to close on a kind of fun cultural one. There's such a spectrum of symptoms of women experiencing menopause. We've talked about so many, some debilitating. Some women get away scot-free. Why?
Not known.
Really?
I mean, the only thing that has been, like, from SWAN, we know that our Asian women tend to have maybe fewer hot flash symptoms, and whether that relates to having diets maybe higher in tofu and phytoestrogens, that has been hypothesized, but it really is not known. There also has been, our Black women have more hot flashes, and those are absolutely linked to experiences of discrimination.
Say more about that.
We have literally measured whether there's something called the everyday discrimination scale. Do you think that you are approached in stores or restaurants more because of your gender, race, age? And when we've done those analyses, there is a higher experience of discrimination related to race in our Black women. And two, Black women in general have earlier, longer, more persistent and more severe hot flashes, and those when they've done essentially statistics to try to tease out what's driving it, experiences of discrimination have, or a significant proportion of those experiences of hot flashes.
Wow. The last question is, we've really talked about how menopause is having a moment. And culturally, Miranda July got a ton of attention for her book, All Fours, which is really a perimenopause book. It's in the news. What is a piece of menopause culture or literature or a resource that you think the audience should check out or that has been valuable for you?
I don't know if this is a menopause book, but the book Night Bitch. Yeah, is it? Okay, I've had multiple patients tell me about that book recently and say that I need to read it. So
Night Bitch. Isn't that a movie?
Is it a movie too?
Is that with Amy
It
Adams?
was a book originally, right? Got it. Yes.
Night
yeah.
Bitch. Okay.
It's about a woman that turns into a dog. Yeah.
Shannon, how about you?
I loved All Fours. I thought that was really brilliant and really interesting. And, in case you're wondering if women can have robust sex lives after they're 50, the answer is yes, according to Miranda July. I just admire women who are doing things in the latter half of their lives that no one would predict. Again, my mother's generation, they were sort of expected to become babysitters, right? And for their grandchildren after they went through menopause. And that's just not the expectation anymore. So I'm a huge fan of anything on Instagram or TikTok, these videos of women in their 70s, 80s, 90s, who are still doing gymnastics, who are still doing marathons, who are still pursuing things that they love just because they love them. I think often in society, women are taught to fulfill their obligations and men are encouraged to follow their desires. And I want us to follow our desires all the way to the end of our lives. And so that to me is menopause porn.
I'm sure there's that too. Thank you so much, audience. Thank you. Thank you, panel.
Thank you all for coming. How about another round of applause for our panel? Sherrie-Ann Burnett, Bowie, Shannon Watts, Pooja Lakshmin, Lisa Borders, our funny lady over there, and our terrific moderator, Morra. Thank you so much.